Hi, my name's Leslie Cochran, and I'm going to present my case study today of a 67-year-old Hispanic obese female who was recently referred to our remodeling heart care clinic after she was diagnosed with heart failure during a 6-day hospitalization. She's accompanied by her husband of 40 years who chose to stay in the lobby. Both patients and the spouse are primarily Spanish-speaking, and in the interest of cultural competency, we will assume that provider would be Spanish-speaking as well. My volunteer today does not represent age or the ethnicity of the patient being represented. The vital signs are 94/64, heart rate is 102, respiratory rate of 22, temperature of 97.6, and SpO2 of 95% on room air. She's 5'1", weighs 195 pounds, with a BMI of 36.8. Let's meet her. Come in. Hi. Miss Gonzalez?
Yes.
Hi, I'm Leslie Cochran. I'm one of the nurse clinic navigators here. I'm happy to meet you today, and I wanted to chat with you a little bit about what you're doing here and why you think you're here and what we can do to help you, okay?
Okay.
I'm going to ask you a series of questions and just try to take a general history here and get some information so we can kind of build a picture and make the best health plan for you that we can. So can you tell me why you think you're here today?
My doctor told me to come.
Your doctor told you to come. Okay. And do you know why he told you to come?
Because I was in the hospital last week and he thought it'd be good for me.
You were in the hospital last week. Okay. Well, I actually do have those records. We're fortunate to be able to communicate with an electronic health record. And so I can see that you were in the hospital. It looks like you have been recently diagnosed with heart failure.
Mm-hmm.
Okay. So what was going on with that? What put you in the hospital last week?
I would get really tired and winded when I'd walk around, and my legs swelled up and I gained about 10 pounds.
Okay, and this is the first time this has ever happened to you? Okay. And you're feeling better now, or?
A little bit.
A little bit, okay. And the swelling is better?
Mm-hmm.
Okay. So do you understand anything about heart failure or what it means?
A little bit. Not
Okay.
much.
What do you know that you can explain to me that you think is happening?
My heart doesn't work like it used to anymore.
Okay, that's true. We'll talk a little bit more about that later. So I'm going to ask you a little bit about your current lifestyle and then also some about your history and what your health history has been over the years, okay? So you said you have trouble getting around. Are you still able to cook?
A little bit.
Okay, and can you bathe and put your clothes on by
As
yourself?
long as I break in the middle.
All right, so you have to take some breaks, okay. And do you have any chest pain or pressure or heaviness in your
No.
chest? Okay, you do not, all right. Do you have any pain in your arm or in your back or your jaw?
No.
None there either, okay. And how far can you walk before you get tired?
About the distance of a Walmart parking lot.
Okay, so from the car to the front door then? Okay. And what do you do that makes it better when you're tired and have trouble breathing?
I take a break.
And how long?
About 15 to 20 minutes.
15 to 20 minutes, okay, great. And then you feel better and you're able to breathe until you get up and, so as long as you're sitting still, you feel fine.
Mm-hmm.
Okay. And do you have any allergies to any medications or?
I'm allergic to iodine.
Iodine, okay. So like IV iodine contrast and?
Yes.
Okay. So you're not able to have heart caths and MRIs without some Benadryl, or you just don't have them, you can't have them
I
at all?
haven't had them.
Okay, great. Okay, so let's go over your medical history a little bit. I see that you have a history of diabetes.
Yes.
All right, and how long have you had diabetes?
Several years.
Several years, like
10.
10? Okay. And do you keep a log, know what your daily blood sugars are?
No.
You don't, okay. Are you checking your daily blood sugar?
No, I don't have the supplies for it.
You don't have the supplies, so you're not checking. Do you happen to remember, or did they even tell you were in the hospital what they were?
No.
No, okay. Okay, let's talk about some other health history. I see that you had a heart attack in 2011, and it looks like maybe you had an actual surgery with a bypass graft with that. Is that correct?
Yes.
And you've not had to have any additional surgery since
Nope.
then? Okay. And can you tell me what were your symptoms when you had that heart attack?
I'm just tired.
Did you have any chest pain with that, or?
Not much.
None with that? Okay. Did you have maybe some symptoms of indigestion, or?
Yes.
You did, okay. So still none of the crushing chest pain or the pain down your arm?
No.
All right. Now, did you ever smoke?
Yes.
You did.
For 30 years.
For 30 years. And wow. Are you still smoking?
No.
Okay. And did you stop how long ago?
About 5 years ago.
5 years ago. Okay. And how much did you smoke?
2 packs a day.
2 packs a day. Okay. For 30 years. Okay. And then I show that you've had a history of high blood pressure. How long have you had high blood pressure? Do you know?
Several years.
Several, like
8, 9.
9 years? Okay. Maybe that was diagnosed about the same time, maybe a little before, about 5 years before your heart attack then?
Yes.
Okay. So you're not having a menstrual cycle anymore?
No.
So did you have menopause or?
I had a hysterectomy at 52.
Okay. Hysterectomy at 52. All right. Do you happen to have a list of medications that the hospital sent you home on?
Not with me, but I do have it.
You do have it. Okay. Well, I have a list here. Let's try to go over them and make sure that I'm showing everything that you're actually on. So I show that you're on metformin, 850 milligrams. You take that 2 times a day. And that's for your diabetes. And then I show that you're taking a 325 milligram aspirin every day. Okay. And you're taking 10 milligrams of lisinopril every day.
I'm not sure about that one.
Okay, that would be for blood pressure. That was probably one of the newer ones that was added while you're in the hospital. You're not sure if you're taking it, not sure if you have it even. Okay. Or if you've ever been on a different dose of it. Okay. And then you're taking the spironolactone and the hydrochlorothiazide. That's a 25-25. You take that one twice a day. That would be the one that would probably make your urine output pick up. You do know you're taking that one. Okay. So we just need to be sure about this lisinopril. Okay. Now, I want to ask you just a little bit about what your family history do you have any history of heart disease in your immediate family, your mother, your father, your brothers or sisters? You don't think so? Okay. And then as far as your support system, do you have family that supports you or helps you?
My husband.
Your husband? And he's here today?
Yes.
But he didn't come in?
No, he stayed out in the lobby.
Okay. And then do you have children?
I do. I have 3 grown children.
3 children. And do they live around here?
Kind of close.
Close, okay. And would they be able to help if needed, or?
They're so busy. I hate asking them to help.
Okay. Okay. I'm going to ask you just a couple of questions about faith and belief. Are you a person of faith?
Yes.
And do you belong to a particular denomination? Or
Catholic.
Catholic, okay. And what are the things that you believe that give you meaning in life?
God.
Okay. Believe in God, all right. And how important is that in your life on a scale of 1 to 5?
7.
Oh, very important. Okay, okay. And what kind of influence does your belief in God have on your behavior during your illness?
It makes you pray a lot when you're scared.
You pray, okay. And you pray for healing or?
Healing and comfort.
Okay.
And peace.
That's great. All right. And is there a part of your church that's that you go to there, a community of people that you're a part of?
There's a group of ladies I cook with.
Okay, a group of ladies that you cook with. Do you cook for the community or?
Each other.
Okay, all right. And these ladies, they support people to you? You guys share your burdens and support each other?
Yes.
Okay, great. And are there any issues related to your spiritual beliefs that you want me to know about, particularly in your care, or anything that you'll need for us to provide for you?
No.
No? Okay. If you change your mind on that or anything comes up, just let me know. Okay. Okay, I'd like to move on into, is there anything else you want to say to me that I forgot to ask, or any information you want to share with me that you think is important?
No.
Okay. What I'd like to do now is I'd like to go ahead and just kind of take a look at you from head to toe and do a bit of an assessment to get you ready for the doc to see you, so that I can give him the information and it'll make his visit with you go more quickly today. Okay. So I'm going to start out with a little bit of a neurological exam. So I can see that your speech pattern seems to be fine. You've not had any history of stroke. There's none of that in your family before. Can you look me straight in the eye and stick your tongue out for me? Can you shrug your shoulders? Okay, great. I'm just going to check your, palpate your carotid pulses here. Fine. Can you follow my finger? Okay, great. Okay, good job. Can you take a hold of my hands and just squeeze for me? Okay, squeeze as hard as you can. All right, and then let this. Okay, great. Okay, I'm just going to see. Can you feel this? Okay.
A little bit.
A little bit. Okay. Let me look at your fingers here. Okay. Okay. Just hands warm. Check your pulses. Now, the next time you visit, we may give you a little bit of a test. It kind of has some challenges with some puzzles and calculations on it. It'll help us have an idea about your thinking process. Sometimes people with heart failure struggle a little bit, feeling a little foggy. Does that ever happen to you? It's about the blood flow to your brain, and we'll give you probably that test the next time we see you, and then as we're able to treat your heart failure and make you feel better, we'll give you that test again to see if we're actually improving your ability to think because your blood flow is improving. Okay? Let me just check these pulses here. Now, do you see a podiatrist?
No.
So you've had diabetes for several years now. You cut your own nails. Can you feel?
Not much.
Not much. Can you feel on the bottom of your feet? So it's very important that you always wear shoes and you have somebody help examine your feet so that you don't get any sores or anything on the bottom. Looks like you're fine right now, but since you can't feel, they might you might have a problem with that, get an infection and not even know. As far as your dentition goes, have you been to the dentist lately? Can I take a peek in there? Open wide for me. So that's another thing we might want to think about is getting some dental care with the patients who have been diagnosed with heart failure. There's a high risk of infection that can come directly from the teeth, so we want to make sure you don't have any infection. Okay. Okay, let me look at, write a couple things down here. I'm going to go ahead and move into your chest. I'm going to be assessing your lungs and your heart kind of at the same time, okay? But I just want to look really, come up here, just really want to look at the shape right now of your chest. Kind of feel here. Just going to do some palpating here. Just feel for some. No pain or anything. You haven't noticed any lumps or anything on your own. I'm just going to do this little on your back. I could get you to take some deep breaths in and out for me. Again. 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 Perfect. Well, I've got my stethoscope. I'm just going to listen to your carotid arteries here. Okay, sounds great. I'm going to go ahead and ask you to lay down, and I can help you if you need me to. Okay, I'm just going to listen to your lungs and heart now, okay? Just breathe normally. Put your hand right up here for me. I'm going to palpate here. Just feeling for the points of where we should be able to feel your heartbeat. I'm just going to move on down to your tummy. So as far as your bowel movements go, are they regular every day? Or
Yes.
You have regular bowel movements. Are they formed or loose or
They're formed.
formed? And you haven't noticed any blood in them? Any dark burgundy blood or any bright blood
No.
at all when you wipe or?
No.
Okay. Okay. Sounds like you're hungry. Just gonna come up here. Have any tenderness up in this area here?
A little bit.
Just a little. Okay, that's where your liver lies. See if I can find your spleen here. Okay. As far as your urine goes, I'm assuming that when you went to the hospital, probably your urine was a little darker. Now that you're taking the diuretics we talked about, is your urine a lighter color? Or?
Yes.
Okay. And do you urinate frequently throughout the day?
Yes.
You do. Okay. All right. And how are you sleeping?
Not very well.
Not very well.
No.
Okay. And why is that?
I wake up a lot in the middle of the night, like gasping for air.
Oh, and when did that start?
A couple months ago.
Okay. That's a new thing then. And then it goes away after you set up?
Yes.
Okay. And does that happen multiple times a night or?
Yes.
Yes. Okay. All right. I'm just going to feel your pulses now that you're laying down. Tell me a little bit about your eating habits.
I don't think I eat very well.
Do you eat fruits and vegetables and those types of things? And
Not very much.
not very much. And do you eat more starches or meat or?
Starches and meat.
Starches and meat. Okay. All right. I want to look at your skin. I just want to note that normally we would do a full skin assessment with the clothes off, but since we're leaving our clothes on because we're recording today, we won't. But do you have any areas that have moles or dark spots that you've noticed, or any problems with your skin? Or?
My arms are more freckly.
Okay, you've got some of the leakage of the iron. Mm-hmm. Okay, but not any suspicious looking things anywhere that you need to talk about. Do you wear sunscreen when you go outside, or a hat, or cover your arms?
Not really.
Okay, something we should consider. So, okay, let me gather a couple things here. I would like to see just about strength. Do you think that you would be able to stand on one leg and then the other?
No.
You don't think you're strong enough to do that?
No.
Now, as far as walking and getting around, do you feel like your muscles are weaker than they used to be, or do you feel like you just run out of the oxygen and get tired?
Run out and get tired.
Okay, all right. Well, I want to talk to you a little bit about the plan I think that we'll have going forward. If you want to set up, you can, or if you'd like to. So I want to talk to you just a little bit about activity and eating habits and those type of things. So you think that you're probably not eating as well as you should.
Mm-hmm.
So we have something we call Life Simple 7, and those are changes that we're trying to make to help with our cardiovascular health. Okay, so I have some information here about it. It's in Spanish, so it'll be easier for you to read. But there are some basic things here that we talk about. One of them is just getting active. And I know that it's hard for you to be active, but if you can just get up and walk around and try to be active for a total of 30 minutes a day, it would help, just to help you kind of gain your strength and your muscle strength. We're working on controlling your cholesterol. We're working on eating better and eating a healthy diet. You should be eating a diabetic diet. And I'm not sure if you're doing that. It doesn't sound like maybe you have the guidelines to follow. Managing your blood pressure, we need to be sure you're on that lisinopril and that you're taking it the way the doctor prescribed. Of course, weight loss is one way that we can all be healthier. A high body mass index or comparison of how your height is to how much you weigh is definitely a high risk factor for cardiovascular disease, and one of the things that gets us all in trouble. Reducing our blood sugar, so we need to be measuring those every day, making sure that those are within the realms of, you know, what we would want them to be. And so we need to be checking those blood sugars every day for you and helping you do that and get the supplies. And then of course, continuing to not smoke, or also those people who live with you or around you not smoking at the same time. So this is some information for that. I need to do a few things to help you, I think, to get you equipped to do these things. We have a heart failure book that we'll be providing for you. It's in Spanish. It talks about heart failure and explains it to you, so hopefully it will help you understand a little more about heart failure. But basically, the bottom line is you had a heart attack in 2011, and probably there's some damage left over from that time that has made the tissue in your heart have a hard time pumping. And your heart's been able to keep up for a while with that, but eventually it starts to fail from the tissue damage, and then it has a hard time pumping. Now you have a lot of room to go on your maximization of your medications, so we can help you with that and make some adjustments in your medications, and the physician will be the one that makes the decision about that, but we've got some room there to help you. But the things that we can really do that are modifiable are those things that I talked to you about. So one of the things I'd like for you to do is every day to take your blood pressure and monitor it, and there's a chart in here for you to use daily, and then when you come back to see us, I'd like for you to bring that. And we can start looking at trends, and you can see what's normal. And I also have a grid in here to help you document when you can take your medications, the times of the day, and you can chart that out, and we'll help you remember. I don't know if you're using anything like that at home now, but it's helpful. Also helps you keep track of making sure that you're taking the medications that you should. And I've printed a list of the medications you should be on, and I'll send that home with you. And I'll be contacting our home care nurses, and they'll be coming out tomorrow to go over your med list with you and to look at your pill bottles just to make sure that you're taking the ones you need. They'll also be sending out a diabetic educator who's a nutritionist, and they'll be helping you with some recommendations for diet and also helping you to get the supplies you need so that we can take those blood sugars every day. Okay, do you have any questions for me?
Nope.
So the doctor will be coming in right now to see you briefly and look at your medications, and then we'll be seeing you back in a week if that works for you, so we can help follow up on your care. Okay? Just nice to meet you. Thank you so much.